Now that it's July, warm weather is in full swing. Although we enjoy that warm weather, it can be uncomfortable and even dangerous for expecting mothers. Joining us today is Megan Doctor, a certified nurse midwife with Sanford Women's, to talk about summertime pregnancy tips. Happy Tuesday.
Hi, good morning. Thank you so much for having me.
Good morning. Thank you for being on our show today.
Yeah, expecting mothers should be especially careful about these hotter temperatures and higher temps. So no matter what the weather in the first trimester, changes in hormones do create kind of just normally increased body temperature. So women definitely need to be careful throughout the pregnancy, but in the first trimester, it's a little bit more difficult sometimes. And spending too much time in the heat can definitely lead to dehydration and exhaustion. So, and then dehydration can lead to preterm contractions and some other stuff for pregnant women.
Yeah, and so we're in July now. We got a few good months left of summer here. So what are some tips that you have to avoid this dehydration and exhaustion?
Sure. So there's lots of ways that moms can stay cool and avoid dehydration. Probably the biggest thing is just making sure that they're drinking lots and lots of water. So at least 8 to 10 or 8 to 12 glasses of water per day. And then if they're going to drink caffeine, to make sure that they're replacing that with water, with extra water. Caffeine definitely can be dehydrating. They can eat cool, water-rich foods like melons and berries, cucumbers and lettuce. And treats like ice cream and smoothies, occasionally can certainly help them stay cool and add to some extra fluid. Paying attention to the weather forecast, and on cool days, going outside is a better way to spend the time than when it's super, super hot. Also making sure that on the days that it is cooler and cloudy, that they're still wearing sunscreen so they can still get sunburned. So just watching out for that. And then wearing loose, lightweight, light colored clothing can also help make them more comfortable. And then if they are outside, and then when they're coming in, elevating feet to avoid or help reduce swelling.
Okay. Yeah, and I know this weekend we're predicted to have some humid, hot weather, so definitely be careful this weekend too. So looking at the forecast, like you mentioned. And then besides swelling, I guess, what are some other signs that pregnant women should watch out for?
So there's a condition called preeclampsia that can create swelling in their hands and feet. It also has headaches, vision changes, and pain in the right upper quadrant of the abdomen. And so with that, if it's untreated, it can lead to liver, kidney damage, and even untreated long-term can lead to life-threatening conditions like seizures. So we would want women to certainly watch out for that. If you're not urinating or having severe constipation or dizziness, those can be signs of dehydration and issues as well. And then if a pregnant woman is extremely thirsty, having chills or clamminess, they should certainly contact their provider. Signs of being overheated and dehydrated. And of course, we always recommend with women, if there's any questions or concerns when they have doubts, to contact their healthcare provider.
And of course, this summer can be particularly stressful for pregnant women due to the COVID-19 pandemic. Any suggestions on how they can stay safe?
Yeah, so we certainly are having a lot of questions about the COVID pandemic with our pregnant women. And it is difficult. There is risk for severe illness from COVID-19 for pregnant women. And so there may be also some increased risk of adverse pregnancy outcomes like preeclampsia or preterm delivery. And so if you're pregnant, and we just ask that you be mindful about your risk, that you be cautious, washing your hands frequently, disinfecting surfaces, And if you are caring for children, you can teach them things such as washing their hands, wearing their mask when they're out in public, social distancing, those techniques to help them stay healthy and to help protect the baby.
Well, thank you so much, Megan. Those are amazing tips.
Thank you.
Have a good rest of your day.
Thank you so much.
And coming up on today's show, blood donations are very important right now. We'll tell you more coming up next.